If you're a new parent, you know the feeling. That beautiful moment of quiet peace with your newborn, and then suddenly, it's just shattered. Well, today, we're going to decode one of the biggest mysteries that new parents face, and we're going to do it together.
Right? This is the big question. One minute everything's fine, your baby is sleeping or cooing, and the next, they're twisting, pulling their little legs up, and crying with this intensity that honestly just breaks your heart. It feels so random, so confusing, but I promise you, there is a logical reason behind it. Let's solve this thing.
All right, time to put on our detective hats. To figure out what's going on the outside, we have to look for clues on the inside, specifically inside your baby's brand new, still learning digestive system.
So, in our investigation, we have two main suspects that are causing all this discomfort. On one side, we've got swallowed air, and on the other, the process of natural digestion itself. Now, they both end up with the same result, a gassy, unhappy baby, but they get there in totally different ways. So let's look at suspect number one, swallowed air. It's actually pretty simple. When a baby eats really fast or maybe doesn't have a perfect latch on the breast or the bottle, it's easy for them to swallow tiny pockets of air right along with their milk. And that air, it doesn't get digested, it just gets stuck in their little tummy, building up pressure. It's incredibly common, so don't feel bad, it's just basic physics. Now for our second suspect, which, is less of a bad guy and more of a rookie just learning the ropes. It's the baby's immature digestive system. See, when your baby is born, their whole digestive tract is basically on its first day of the job. It's learning how to process milk, how to move everything along, just how to work in a coordinated way. And this right here, this is the core of the issue. Think of it like a new highway with really bad traffic flow. Because a newborn's intestines are moving slower and they aren't quite coordinated yet, gas that should just pass right through gets stuck. It creates a little traffic jam, and that backup builds pressure and, well, a whole lot of discomfort. But hang on a second, we all get gas. It's a totally normal part of being human. So if this is all so natural, why does it seem to cause such awful, intense, painful crying in a newborn? What are we missing here? What's the real secret to all this pain? The answer is actually fascinating. The real source of all that crying isn't just the gas itself. It's the baby's physical inability to get it out. So let's unlock this pain puzzle. Okay, here is the absolute key. When you or I feel gassy, we can tighten our stomach muscles to, push it out. It's an action we don't even think about. A baby just doesn't have that conscious muscle control yet. They feel all that pressure building up, but they literally can't do anything about it on purpose. So what happens instead? Well, it's like a chain reaction. First, the gas builds up, causing pressure. Second, the baby feels this, and their only way to communicate that discomfort is to cry. And then third, their body has this amazing unconscious reflex. They instinctively pull their legs up towards the belly. And what's so wild is that this movement, the very thing that makes them look like they're in so much pain, is actually their body trying to help. It puts pressure on the abdomen, and it can help move that trapped gas along. So when you see your baby doing that, it's their little body trying to fix the problem all on its own. It's not a very efficient process for sure, but it is a sign they're working on it. Okay, so we've figured out the cause, we've unlocked the pain puzzle. Now we get to the most important part for you as a parent. How do you know the difference between just normal, developmental gas pain and a sign that you might need to call the doctor? This chart lays it out so clearly. On the normal side, you've got the signs of a perfectly healthy, if gassy, baby. They're still growing, they seem to feel better after they pass gas, and there's no major vomiting. But if you start seeing signs from the worrisome column, like crying that just never stops, they're not eating well, they're losing weight, or there's severe vomiting, that's your signal. Time to check in with a pro. But let's just take a breath for a second and focus on this, because it's so important. The vast, vast majority of the time, this is all completely normal. It's a temporary phase. It's just a sign that their little digestive system is growing up and learning how to do its very important job. You're doing great. All right, now for the good stuff, the practical part. Knowing why it's happening is empowering, but what you really need is a what to do now. So let's build your personal toolkit with some simple, safe ways you can bring your little one some immediate relief. Here are 3 go-to methods that really work. First, good old-fashioned burping. Holding your baby upright after they eat helps release that swallowed air we talked about earlier. Second, a gentle tummy massage. If you use clockwise circles, you're actually following the natural path of their intestines. You're helping things move along.
And third, little leg exercises, sometimes called bicycle legs. Gently pushing their knees to their belly just helps them do what their body is already trying to do naturally.
And beyond all the mechanics of these techniques, never forget the most powerful tool you have, your calm presence, your gentle touch. That is incredibly soothing for your baby. You are their safe space, and sometimes that comfort is the best medicine of all. So let's talk about the final chapter of this story. Because every parent who's in the middle of this, listening to those cries, needs to know that there is a resolution. This gassy, tear-filled chapter does have an ending. And here it is, the best news you'll hear all day. This problem has an expiration date, I promise. As your baby grows over these next few months, their digestive system will get stronger and more coordinated. Passing gas will become easier and more efficient. This whole phase, it will pass.
So let's end on this powerful idea because it really captures what we tried to do today. Understanding eases anxiety, and knowledge grants peace of mind. By decoding this little mystery inside your baby, I really hope you feel more empowered, a little less anxious, and a lot more confident as you go through these incredible, and yes, sometimes challenging, early months. You got this.